Good afternoon, this is Dr. Doe. This video is an alphabetic list of problems and what kind of problems you need to see emergency, what kind of situation you can manage at home, or you can call your physician or make appointment. We finished the A and the B. Last time we talked about the bleeding disorder and the coagulation disorder. It's transition from B to C. Later on we're going to come across some conditions and some other information regarding to the coagulation. But today I'm going to start with C. Problem start with the letter C. The first thing came to my mind is the chest pain. Because it is very common, it could be very serious, life-threatening, like a cardiac attack, or it could be just minor from the heartburn. So before I start to talk about the causes of chest pain, let me just give you some idea what kind of chest pain is a sign, a warning sign, warrant an emergency visit. Chest pain associated with the exertion, exertional chest pain. When you're doing something, especially when you're doing high demand of oxygen, like running, either slow or vigorously, long distance, or you use your hand to do the strength movement. If triggered by this kind of situation, you start feel chest pain. That usually, especially when you're older, I'm not talking about the young, healthy people without any medical condition. After you move your arms, you feel chest pain. That probably is different. However, if the chest pain continuously with the exertional, when you're doing something, or when you or the chest pain does not go away, especially if it is associated with difficult breathing, you feel dizziness or headache. Even though young people, if you have chest pain, if you have dizziness, difficult breathing, shortness of breath, associated with chest pain, especially the exertional after you're doing some activities that trigger chest pain. So this is the first sign of emergency. It could be a heart cause, the heart attack or cardiac malfunction. So if that's the case, do not hesitate, especially for those older, had comorbidity, like have other medical conditions, hypertension, diabetes, or coronary artery disease. You know you have it, and now after the vigorous exercise or doing some physical activities, you feel chest pain. Do not hesitate, especially associated with difficult breathing, and the chest pain may radiate to the shoulder, or the pinky finger. So that's the left shoulder. That's related to the serious problem. The other chest pain is, I said previously, I mentioned, if you know you have sickle cell disease genetically, if you have severe chest pain, that probably means another flare up. So go to emergency, get rehydrated, get treated. The other chest pain associated life-threatening situations like pulmonary embolism. I talked before. Like pulmonary embolism does not occur in normal people unless you have extended immobility. For example, you have the fracture and you bedridden for a long time, and then you suddenly feel shortness of breath, chest pain, or you have pre-existing conditions, like I said, the same as the cardiac problem, or you have the AFib, atrial fibrillation. If you know it, if you have it, you will know it. So this kind of patient, you know you had this pre-existing problem or comorbidities. If you suddenly have chest pain, shortness of breath, go to emergency. Do not hesitate. The other possibility could happen to young people. Remember I talked about the heart. There's some structure wrapping outside of the heart called the pericardium. Those structures can be inflamed if with or without systemic disease. Sometimes like lupus or rheumatoid arthritis can trigger this pericarditis, or you just some infection also can cause this, and you feel chest pain. The thing is, if it is simple pericarditis, it's okay, but sometimes the inflammation causes the fluid. so the fluid between the pericardium and the heart, so then there's a limited space for the heart to contract. So if this is the case, it's not common, but it could happen. So if you have this usually happen to the young people, or for those had systemic like connective tissue disease like lupus or rheumatoid arthritis. And there's another condition associated with the lung, not necessary for the heart, can cause the pneumothorax spontaneously without any cause. Just sometimes after a long time, a deep breathing, just the pneumothorax spontaneously, no cause, no injury. If that's the case, usually it's not very serious, but still you need to get a checkup, make sure there's nothing serious going on. So this is the major cause of chest pain that warrant you go to emergency. There are others like for hypertension patient, older patient, feel cruciated chest pain. That means aorta dissection, which means the aorta, the major, one of the main artery out from the left ventricle, probably there's some tearing, or the aorta tearing, or the dissection. So means there's some broke on the aorta, which is life-threatening. That pain is different from the heart attack. It's like cruciating chest pain, and located along the sternum border. So if that's the case, you need to see the emergency. These are the very common cause of chest pain that also could be very life-threatening, and you need to see the emergency, especially for pretty much occur for those had pre-existing hypertension, diabetes, or other problem or arrhythmia like AFib, such like this. So if that's the case, I'm sure your physician has told you if that happened, you need to go to emergency. So basically, this is the chest pain. There are many causes. It could be the heart, could be the lung, or could be just the bone, the ribs, or the muscles, or could be the digestive system, just the dyspepsia. So these are all the causes for chest pain. I'm going to break down next time. This time, just to briefly introduce to for those emergency situation. And next time I'll just talk individually regarding related to the disease and what kind of treatment or how to prevent them. So this is for this video, and thank you for watching. I will see you next time.